I'm Danny Keenan. I'm here to talk to you today about a new product we're bringing out, National Clinical Audit Benchmarking, NCAB. I'm the Medical Director of HQIP, and we've been piloting and taking this project forward. So just to put this in context, so we run the National Audit Programme up to 40 audits. The audits come out with information every year. That information is directed in various ways. One is to patients through NHS Choices, and the other is to the service through generally the annual report. But it has become apparent to us that the annual report has been very difficult for that audience, that is the clinical audit staff, medical directors, clinical directors, nursing directors and commissioners. It has been difficult for that group of colleagues to work through those reports and extract for their service what it's really telling them and what they need to work on to improve the service. Similarly, for the regulator CQC, who also have had the same difficulty, for want of a better word, of working through the reports. So I'm going to introduce you today to this project, which is National Clinical Audit Benchmarking, so that you understand how we are working with the audit providers to help making this information much more usable. Just to take you through the process that we went through, I have with me here an example of an annual report. This is a relatively extreme version of that. So this is the annual report, which continues on and contains huge amounts of information, which is of course incredibly important and relevant. But addressing the NCAB project, so how can we help a medical director, audit staff, etc., how do we help them get their relevant information as easily as possible? So what we set to was, and I have to acknowledge Sid Sinha, one of our previous fellows who did a lot of this work, and Kieran Mullen, who's carrying it on. So we approached the audit providers and asked them, okay, you're measuring lots of these metrics. What are the 5 key areas that you think are really important that you're measuring that could make a difference? And each one of those audits that I mentioned earlier came up with their 3 to 7 metrics that were the really important metrics for them. So armed with those metrics, we worked initially with the CQC information team. The audit then flowed across from the audit providers into CQC. Their informatics team started to analyze these metrics to put them into some kind of usable format whereby a medical director, audit staff, etc., could look at this relatively easily and relatively quickly and get a picture for their service, and then propagate that on out into something that can improve the service. So what does this really mean in practical terms? So obviously the big report is there. The medical director, of course, and colleagues can go into that and get the nuances. But what are we doing in this project to really make things easier and better and quicker? So what we're doing is we're displaying on our website the individual results in one PDF. So that's one slide will be up, and the medical director, the audit staff, and whoever can go on and look at and really quickly find out how they're performing on those 3 to 5 metrics benchmarked across the rest of the country. So immediately they will see within minutes how their unit's performing and what they might want to focus on in terms of improvement. The project was piloted in Greater Manchester. So what we did here was, with the informatics team, we had I think it was 7 trusts in Greater Manchester with the first 6 audits, and we put together the information into these PDF documents, and we sent them around in fact it was the full teams in the Greater Manchester Hospitals, medical directors, clinical directors, nursing directors, audit staff, and we got back feedback. Feedback was incredibly positive. actually every medical director was overjoyed because they understood immediately that they very quickly were seeing these quality markers for these key units. There were a few pointers to improve the slides, and indeed when we went out to pilot this nationally, which we've just finished, there were one or two other improvements. The key improvement actually was the on the slide on the PDF was to make the key that allowed you to understand what was on the side, to make that much more explicit so that it was easier to follow the slide and to follow the little bar graphs as to what they were showing. I'd like to introduce you to the medical director from Stockport. He's going to give you his view, his feedback on the project that we piloted in Greater Manchester.
The benchmarking dashboard for our national clinical audits offers a number of benefits to medical directors such as me. Firstly, it gives us a common format in which we can look at the results. I'm pleased to say with the results I've looked at so far, there were already results I was very familiar with. But what it did offer was an ability for me to sense check the results that I'd already seen. Firstly, to make sure there's not been any national clinical audits that I've overlooked. And then secondly, really just to sense check the conclusions I'd drawn having seen the original reports and had my team review them. So both of those are real benefits, really just in making sure that none of the clinical audits get overlooked and there's potential for improved patient care, those opportunities get missed. So I think that offers some real benefits in that regard. In practice, how will I use the benchmarking dashboard? Firstly, as medical director, to do regular eyeballs of the data that's there to make sure that it's aligned with all the stuff I already know about the organisation. Secondly, in the Quality Governance Committee, which I chair, it gives me an ability to present an oversight of the audit data to see how we are managing against national and peer standards. And I think that will be a real useful benefit. And then the third benefit that I would really cite for these is that they are going to be openly published and available to the public. And I think that aligns very much with the behaviours we are extolling throughout the NHS about greater transparency and public awareness of what goes on. So I'd welcome that greater visibility of the audit results, and I think that will be another significant benefit. So overall, I see this as a really great development for me and for our ability as an organisation to ensure our learning from national audits is as good as it can be. And I look forward to it coming online.
I hope that you understand what this project is about now. This is obviously a project whereby we're bringing this information out to the leadership team, the medical director, clinical directors, etc. However, this is going to be really helpful to the local audit staff who currently are, in fact, sometimes making their own reports. So this will be incredibly easy. Log on to our website, download the document, and suddenly they have in their hand a summary of that service and how it is benchmarking across the country in 3 to 5 to 7 metrics. And hopefully that will allow them to concentrate on the improvement bit of all of this and release them from some of the more onerous work they have to do. I hope you find this helpful. The first 6 audits we're starting with, and we're aiming to have the rest out as soon as we can. It's really important to us that you find this helpful. Please go on the website, look at the audits, email us or contact us, let us know what you think. Is this helpful to you? Are there ways that we could change this to make it better for you? Because that's what we're doing. We're working in partnership with you to make the audit program much more vibrant and live, so it really does make a difference, and we understand you're the people that can make the difference. Thank you very much for listening.